Hi, I'm Scott Cutler, and I'm going to comment on our study entitled Hepatitis B Seroprevalence and Disease Characteristics in an Urban Chinatown Community. First, I want to mention why we did this study. We have a hepatology clinic in a busy internal medicine practice in Chinatown in Chicago, Illinois. We were impressed that screenings can sometimes overestimate hepatitis B seroprevalence because they can select for people who've already tested positive in the past. We were also impressed that there's limited information about hepatitis B disease characteristics in Chinese immigrants. As a result, the aims of the study were, one, to assess hepatitis B seroprevalence in an unselected population of Chinese immigrants, and two, to determine the prevalence of e-antigen positive and e-antigen negative disease in these patients. Here's a brief overview of the methods. We reviewed the medical records from all patients who had at least one visit to a Chinatown internal medicine practice over a 2-year period. The physicians in the practice routinely try to screen their patients for hepatitis B. Data collection included demographic information as well as labs consisting of surface antigen, e-antigen, ALT, and HBV DNA level. We used copies per ml because measurements in international units were not available in all cases. 3,012 out of 4,671 patients had surface antigen testing. This is a real-life experience, so not all patients had hepatitis B testing during the study period. Now let's turn to the highlights of the results. Overall, 11% of those tested were hepatitis B surface antigen positive. Persons aged 30 to 39 had the highest prevalence at 14.9%. Of those patients who had e-antigen testing, 25% were e-antigen positive and 75% were e-antigen negative. Let's consider the e-antigen positive patients first. 60% of the e-antigen positive patients with available testing had an elevated ALT level and an HBV DNA level of greater than 10 to the 5th copies per ml, suggesting e-antigen positive chronic hepatitis B. Regarding the e-antigen negative patients, 16% had an elevated ALT level and a virus level greater than 10 to the 4th copies per ml, suggesting e-antigen negative chronic hepatitis B. In total, more than 25% of the surface antigen positive patients with available testing could be considered candidates for antiviral therapy based on ALT level and HBV DNA level. Furthermore, 31% of the surface antigen positive patients had virus levels greater than 10 to the 5th copies, which is associated with a relatively high risk of progression to cirrhosis and the development of hepatocellular carcinoma. So what are the implications of this study? The data put the magnitude of the hepatitis B disease burden in Chinese immigrants into perspective. Given that there were approximately 2.5 million Chinese Americans according to the 2000 U.S. Census, a very large number of Chinese immigrants are at risk for progressive hepatitis B and might benefit from therapy. The findings show the importance of increased testing, awareness, and education regarding hepatitis B in Chinese immigrants, and show that it's critical that physicians caring for Chinese and other Asian immigrants understand the scope of the problem so that persons with hepatitis B are identified and get appropriate medical care.